Good evening and welcome to my Tuesday evening show. It's so funny. Anyway, if you don't know, I'm Dr. Melissa Green. I'm a licensed clinical psychologist and a registered yoga teacher. For some reason, I always seem to forget to say that, or at the beginning or at the end, but thank you for joining me tonight. Tonight, I'm going to talk about dementia, what dementia is, and different types of dementia. And if you know someone who you suspect may have dementia, I have a free resource that you can get. I will put the link in the comments to this video, and you can just access it. It has 7 helpful evaluations if you suspect dementia. For some reason, my screen just went dark. Anyway, it's 7 helpful evaluations if you suspect dementia. And again, I'll put the link right in the comments. So, dementia is actually an umbrella term that is used to describe a group of major neurodegenerative disorders that affect cognitive functioning. It's essentially it's a brain disorder that gets worse over time, and it impacts a person's functioning. And oftentimes you may hear people talk about things like Alzheimer's disease, and use the term Alzheimer's disease interchangeably with dementia, but there is a difference. So dementia is an umbrella term, and there are different types of dementia, and Alzheimer's disease is actually a type of dementia. And so in order for it to be considered dementia, it has to have a few aspects. One is probably the one that many people think of when they think of Alzheimer's disease is chronic acquired decline in memory, but it can't just be problems with memory. It also has to be at least one other cognitive functioning where there is a significant decline or impairment, such as language or visual spatial skills or executive functioning, which I talked a little bit about a few weeks ago, or judgment. And those things also have to interfere with a person's day-to-day functioning. And there are lots of different types of dementia, but there are 4 common types of dementia that you may hear about more than others. And so those are the ones that I'll talk about tonight. The first one being Alzheimer's disease. And again, it affects memory, it affects thinking and behavior, and there's a wide range of what it can look like if a person has Alzheimer's disease, but it definitely, the impairment definitely interferes with the person's ability to do day-to-day tasks and function independently eventually. Also, a couple of the main features that have been noted in brain scans when they're looking at people with Alzheimer's disease, there are plaques and tangles in the brain. Also, there's a loss of connection between the nerve cells or the neurons in the brain, so they're not communicating right. The messages are not going from one to the other. And that's how people eventually lose functioning of certain parts of their bodies and things like that. So the time from diagnosis to death, it varies, but on average, a person with Alzheimer's disease lives anywhere from 4 to 8 years after being diagnosed. Now, again, this is average. There are people that live, 10, 20 years after being diagnosed. So this is just an average. And Alzheimer's disease accounts for about 60 to 80% of dementia cases, according to the Alzheimer's Association. And contrary to popular belief, Alzheimer's disease is not a part of normal aging. However, as we age, there's an increased likelihood that we could get Alzheimer's disease. And the majority of the people that are diagnosed with Alzheimer's are 65 and older, but there are some people who have younger onset of Alzheimer's. So anybody that's diagnosed under 65 is considered to have that early onset. There's no cure for Alzheimer's disease at the moment, but there are treatments to slow down the progression of the disease. And there are different phases or stages. The Alzheimer's Association, I believe on their website, they refer to it as stages, 3 main stages of Alzheimer's disease. There's the early stage where there's mild impairment, and this is considered from the time of onset of symptoms up through the first 3 years. The person might not be oriented to the date, so they may not know what date it is. They might have some problems recalling recent information. So if you ask them, hey, what'd you have for breakfast this morning? They might have difficulty remembering things like that. They might have some difficulty even copying figures on a piece of paper or naming things. They might not have the same level of insight about things that they did before. They may even become a little bit more withdrawn socially from friends and family. They might have some difficulty managing their finances. And you might notice some changes in their mood and might become a little bit more irritable. And this is in the phase 1 or stage 1 where there's mild impairment. The second stage is stage 2 where there's middle to moderate impairment, and this is considered from the onset of symptoms through 2 to 8 years from the onset of symptoms. This is considered the moderate stage of impairment. And in this stage, the person might actually be very physically capable of doing things, but they might be more cognitively impaired, which can make it a little trickier to be able to manage them and to monitor their safety, because they might be able to do a lot of things but not have the cognitive ability to really process or understand what they're doing, what's going on, and why they're doing it. So for instance, somebody that is in this stage that is in good physical condition may like to go for walks, and then they may end up forgetting why they went on the walk or where they're going, or get disoriented as far as space and time. So this is a more risky stage where there may need to be a little bit more monitoring and oversight. The person might have some problems doing basic math calculations or comprehending problems. Also, they might have some difficulty learning new information. They may even start to become really agitated and sometimes even aggressive. They might have delusions and think that people around them are stealing from them or doing things that most other people around them might think would be odd or that the person just wouldn't do. Um, and they could be really fixed on those delusions sometimes. It can be difficult to redirect that person. They might get lost in a familiar place. They might have some problems with their dressing and grooming, and they might, you know, not be in a position to be able to do their own banking, like I mentioned before, or cook independently, or even shop alone. So that is phase 2, or the middle phase or moderate impairment phase. Phase 3 is the severe impairment phase. And this is considered anywhere from 6 to 12 years after the onset of symptoms. And the person's memory has declined significantly at this point. They may have no remote memory. Usually we might see more difficulty with remembering newly acquired information initially, but over time, even the remote memory is gone. And their speech is almost unintelligible, so it may be very difficult or impossible to understand what the person is saying. They might become incontinent, and there may be more motor agitation. At one thing I think I neglected to mention in the previous stage, you might notice that the person might become a little bit more restless and start rummaging, and you could see some of this to I guess a higher degree in the severe impairment if the person is actually physically capable of, you know, getting around. So that's Alzheimer's disease. Just a brief overview. The other the other 3 of the 4 most frequently diagnosed types of dementia are vascular dementia, and with vascular dementia, about 20 to 30% of the people with dementia have vascular dementia, and it results in a decline in thinking that's caused by conditions that actually block or reduce the flow of blood to different parts of the brain, and consequently there's a lack of oxygen or nutrients that are supplied to those parts of the brain where there's a loss of blood flow. And when there's, you know, that disconnect, then the brain cells cannot communicate to different parts of the brain to, you know, tell it to, you know, operate different parts of the body. Another type of dementia is dementia with Lewy bodies, and this accounts for about 10 to 25% of the people who are diagnosed with the type of dementia. And it is a progressive type of dementia that also leads to a decline in thinking. This thing wants to fall. A decline in thinking and reasoning and a person's ability to function independently. There may be some very sudden changes in a person's ability to focus and sustain their attention for extended periods of time, or their ability to be alert. There may also be more hallucinations, particularly visual hallucinations that are happening pretty frequently. Problems with REM sleep, And also, you might notice a what we call psychomotor retardation, where their movement could be slowed, or there could be tremors or some rigidity in the muscles, and that is dementia with Lewy bodies. And then the last one that I will mention today is frontotemporal dementia, and that accounts for about 10-15% of the cases of dementia. And again, it's a progressive type of condition where there's a loss of nerve cells in the brain's frontal lobes, which is the part of the brain that's like right here behind your forehead, and or in the temporal lobes, which are right on this the side of your head. That's where there is problems with in the brain or with the nerve cells in that area. So this is a brief summary of dementia, and types of dementia. So just remember that dementia is not a diagnosis. Dementia is an umbrella term that when you hear people say dementia, they're talking about, they could be talking about a wide range of conditions that are considered to be dementia, or conditions that are associated with dementia. And the four that I just mentioned: Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia, are the four that are diagnosed most frequently. So again, if you have not already done so, go to the link that'll be in the comments below this video and download my free resource. It's 7 evaluations to consider if you suspect dementia, if you or somebody else that you know has cognitive difficulties, and you suspect that there may be some significant decline or even just mild cognitive impairment, and you want to get checked out. These are evaluations that you should seek out. All right, good night.